sterile gloves on. Notice I'm working well above my field here. I'm not taking any chances on brushing these gloves against anything. If you want, you can get that out of the way or just move it like that, whatever. So now I've got my wet gauze in here. I'm gonna pick it up, wring it out a little bit, and we're still sterile. So I gotta be really careful, okay? And I'm just gonna clean around the wound edge, okay? I don't wanna rotate it in my hand. I could contaminate my gloves. So you're done with that, you throw it away. Grab you up a couple more. And I've kind of got my fingers kind of coiled up in there where I'm not going to touch, anything. Okay, I'm done with that. So now we're good to go there. We're still a little wet, and our tape has got to stick right. So now I'm going to get dry. Same thing. Throw it aside. Get a couple more, get everything nice and dry, okay? So now we're nice and dry. So now we're ready to pack the wound. I'm gonna go back to your wet gauze, wring it out, and then it's called fluffing. You hold it away from your body so you don't contaminate the gauze. You open it all the way. And then just kind of fluff it. Set it in the wound, like so. Okay, so the size of this wound, you could get some decubitus like on the back side that are that big. But usually on an arm you're not going to see anything, but it looks like it's not covered well, right? So I need to actually fluff up another one. Oh, got to wring it out. You don't want this soaking wet. You just want it wet. You don't want it dripping, in other words. Fluff this one. We'll put it in this end, okay? So we got the wound bed covered. Now we're going to take dry gauze. This is the moist part, that's the wet. This will be moist. I only need 2, but I picked up 3, and that's okay. I'll just throw one away, lay that one there, lay that one there. Now I've got my ABD pad. The blue stripe goes up. Lay it there, just lay it on top. I don't have to worry about being sterile anymore because this tape isn't sterile. The wound is covered. Okay, I mean, you're not going to go digging around in there, but get your piece of tape. And put it across the middle. So I don't care if I touch the bed, I don't care if I touch his gown now, because we're good. Then you get you another piece of tape. Here. And then one more. Like so. Now the last thing you do, and I don't have an ink pen on me, you can write it on here, but you need to date. So today is 9/17, so I'm going to write 9/17/15 with time is 13:50. I want to put my initials. Okay, you don't want to write directly on the patient. Just take this piece of tape and stick it somewhere. I always put it over the middle one. Okay, that way the next nurse can come in and look and say, okay, you changed it on the 17th, it was 10 minutes to 2, and that's who changed it. Okay, that's the final step. Then you go chart it. Remember, your charting's looking pretty good. Don't write patient this, patient that. We know you're dealing with the patient. Just say, removed wet to dry dressing using clean technique. That's what we use, right? So you have to state that. When you put the chart to Foley, inserted whatever French Foley catheter using sterile technique. Patient tolerated well. 450 milliliters of urine returned to the Foley bag. So it means that, you know, and that's all there is to it. There's nothing, I mean, it's just really simple. So here, removed dressing using clean technique. I said scant drainage, scant, serosanguinous drainage noted, no foul odor. Applied wet to moist dressing using sterile technique, right? So I said use clean technique to take it off. Applied wet to dry dressing using sterile technique. Patient tolerated well. I mean, it's bam, it's just a few words, right? But you have to there's certain things that we expect you to put down as nurses. So took the old one off using sterile technique. Because if let's say, or using clean technique, because let's say if you didn't differentiate that and you said remove the old, it's a way of protecting us. Let's say they get infected. Well, we use sterile technique. We charted that we use sterile technique. We're good to go. We use sterile technique. But if you just said remove the old one using clean technique and then put the new one on, and you don't say sterile technique, then it leaves an opening in court. That lawyer says, but you forgot, you didn't do, you know, I mean, it could set you up. So that's what we word things a certain way, okay? So we put the Foley in, use the sterile technique. We put this, remove the old dressing using clean technique. Reapplied new wet to dry dressing using sterile technique. Patient tolerated well. Nothing else to chart. That's it. You don't have to write this whole paragraph, okay? Any questions about this procedure? This one was smoother.